CataractCoach.com. Resident Cataract case number 101 review. What advice can we offer to this young surgeon in training? Anonymous resident here, not my resident. Not sure where this video is from, but we're going to watch it. It was submitted as case 101. Looks like the surgeon is sitting superiorly, and there's a side port probably. A little bit on the wide side. Maybe we're going to do a bimanual IA. Maybe it'll be a second pair. Let's see. Trypan blue dye again. And just kind of getting things set up, I suppose. And we're showing you the video, of course, at 3 times normal speed so we can watch the whole thing. And then washing out the trypan. Here comes our viscoelastic. There you go. Nice looking fill. And let's see the main incision. Let's see the magic. Here's the keratome. And going in. And pretty reasonable. Reasonable incision there. I like that. So it looks like it's going to be a right-handed surgeon. And HPMC, hydroxypropylmethylcellulose on the surface of the cornea. A little bit higher magnification now. And let's see, going in with a cystotome. And another issue we see here is off the screen. So that's a common thing. Remember, your view in your oculars is a wider field than what's recorded on the video. So you got to keep the eye really well centered throughout. So fixating the eye with the left hand there with the forceps on the conjunctiva, right hand's using a cystotome to do the whole rhexis. I like it. Looks like no forceps needed. Just a cystotome-made capsular rhexis. That's actually harder than you think if you haven't tried it before. But once you get used to it, it's pretty easy. And now a little bit of a patient adjustment or patient movement. And then another paracentesis being made here. So a little on the wide side of those paracenteses, but we'll see that at the end. And remember, why is it important if it's wide or not? Well, because you have one source of fluid going in the eye, the balanced salt solution, right? But there are 2 sources of outflow, the leakage from the incision and what you aspirate down the tip. Here comes the hydrodissection, a little more viscoelastic. Let's see the Feco technique. So it looks like zooming out again now. And okay, rotating the nucleus with a chopper. That rotates just fine. I'll pinch more viscoelastic. And good draping, by the way. Lashes out of the way, lid margin sequestered. All right, chopper coming in, and here comes the Feco probe. And let's see what technique we're going to do. And is it going to clean up some of the anterior cortical material? And looks like a little groove down the middle. I like that. So a half groove, so probably to chop then. Let's see what's going on here. Maybe like a deep pit or half a groove. Yep. And now the chopper goes in. That's a nice technique. So making a little bit of a half groove just so you can really embed the Feco tip and get a great purchase or hold on the nucleus so it can be chopped. And now chopping it into much smaller pieces. Hey, very nice technique. You certainly have very good hands. And rotating this around to chop it even more. So into the nucleus here and chop, chop, chop. Again, chop really is not that hard to learn. You can do it. If you're used to just doing divide and conquer or stop and chop, I promise you can convert to chop. Just watch these videos. We've got a whole series on learning how to do Feco chop. And you can see it's so much more efficient. Now, yes, we are showing you this video sped up by 3 times normal speed. But again, I just want to show you the whole case here. In your own clinic, your own practice, if you've done 100 cases, take your time. No sense in rushing things. So one thing I want you to look at is, look at the Purkinje image, the light reflex. See, it's not really in the center of the cornea. The surgeon needs to put both hands down a little bit. See the eye? That's more like primary position. Even that's not perfect. So I'd like to get that. That's better. See the hands down. Now the red reflex returns. So you lost the red reflex because you pushed the eye out of primary. This is primary. See the red reflex is sharp? Do you see that one light, the Purkinje image? It's right in the center of the cornea. That's how you want to keep it the entire case. Here's the bimanual, as predicted, the bimanual cortex removal, bimanual IA. That's a nice way of really cleaning things up here. Bimanual does, of course, give you very good access to 360. In other countries outside the U.S., the bimanuals are a lot more popular. In the U.S., still, for whatever reason, coaxial is a more popular way of doing the cortex removal. Fortunately, everyone has switched to bimanual vitrectomy. In the rare case you have to do an anterior vitrectomy, certainly do not revert back to the ancient technique of coaxial anterior vitrectomy. You definitely want to do it bimanual. So good cleanup here of that lens material. And it looks like a nice red reflex. See that eye in primary. And then go rewind the video and you'll see during the nucleus removal, the eye was not in primary. So you lost that red reflex that was just not ideal. So you want to keep that eye in primary. Here comes the lens. Let's see what we got here. Looks like a Single piece acrylic lens probably. There it goes in the bag, being pushed in, delivered in nicely. There you go. So getting that lens in the capsular bag. Oh, the thing that one haptic is on top of the iris at this point. And so fixating the eye, going into the side port, hey, dialing it in. Good dialing technique. And you can see the rexus size, probably about a 4.5 rexus, because that optic is going to be 6 millimeters. And now cortex removal, the viscoelastic removal with the same bimanual instrumentation that was used for the cortex removal. And cleaning all that up, really get the high flow though. I don't know if you've removed enough viscoelastic. I'd get the flow setting much higher. So for reference, for me, Feco, I do 40 cc's a minute of flow. My cortex removal also probably 40. But when it's time for the viscoelastic washout, I bump that flow rate up to 60 or more cc's per minute. End of the case, everything looks great. Beautiful job. Thanks for submitting the video. Keep up the good work.